you must start taking tretinoin or retinol, especially when you are pregnant or if you're about to get pregnant. And it is very important because tretinoin or retinol have been noticed, or research has shown that one of the major causes of baby deformity or deformity of the baby from the uterus or in the uterus is the use of retinol or tretinoin, and most especially for people that also take it orally. Yes, there is an oral form, oral dose, or oral medication, also called tretinoin. And it might interest you to know that when an individual takes tretinoin, or when an individual consistently exposes herself to tretinoin skincare products and vitamin A based skincare products, what happens is there is high chances of miscarriage. And most times miscarriage happens because the chromosomal qualities of this egg, of this particular zygote, is to be questioned, and the body or the uterus cannot continue to incubate something that is not perceived to be human, or not perceived to carry the chromosomal qualities that an actual human should carry. What happens? The uterus rejects the zygote. Do you understand? So in that particular picture, you find out that this person undergoes miscarriage. You need to check yourself. Are you using retinol? Because I know that you get to the hospital, most times your doctor don't really ask you this question. They don't ask you, what skincare do you use? No, they don't ask you that. They ask you your family, is there any hereditary sickness? Do you have BP in your family? Those are the major things that we ask. Those are the major things that we ask. Okay, by the way, I am not counselor. No, I am speaking from an urgency. Pardon me. Okay, this is sexuality and health wellness. Do well to like, subscribe, turn on the notification, because there are a lot more going on in this channel and you don't want to miss it. Right? So you find out that these are the things we ask. We don't ask you, oh, which skincare did you use? No, we don't ask that. And many women want to preserve their physical appearance, right? Many women are so conscious of their facial appearance, their bodily appearance, so they can do anything to actually maintain it. And for some women that have that OCD of I must look good, so they go miles. And even if it consists of doing extraordinary things when you're pregnant. And of course, we know that pregnancy can actually humble you. Pregnancy can expose you to having acne, even if you've never had before. Pregnancy can bring acne your way, and you're like, gosh, where is this coming from? And now you go ahead and use tretinoin, you go ahead and use retinol, and we know that these products, these vitamin A based products, are very effective. I mean, I've used them and I know what they can do. They just make your face smooth. So, and now because you find out that this works for me, you go and get a carton of treatment because you have the money. Get the carton. As this is finishing, you are opening the next one, you are rubbing it, and your face is responding. Your body is and every part of your body is And when you find out that there is an oral dose of tretinoin or retinol, you go and get it, and then in your mouth. Let's get there. I mean, I gotta look neat and cool, that, and you don't know that you're causing harm to this baby. Deformity. Deformity is another thing that takes place when you start making use of these products consistently, and of course when you're pregnant. So your baby gets deformed, physical deformity and mental deformity. I saw a baby that had an encephaly, and that particular deformity, that baby cannot do any. In fact, the baby died Yeah, the baby died. Now, that's a deformity of, the mental part of the body. So the baby actually died. And it's not cool when you give birth to a child and then you find out that this baby has cleft palate, this baby has cleft lips, and now the baby has to live with that for the rest of his or her life. So this message is coming across so that we can have this understanding. And when you go for your antenatal, you tell your doctor, see the product I'm using for facials. The doctor will not remember to ask. So tell your doctor, I beg you. I was at the skincare shop the other day and this guy brought a particular jar of stuffs, colored stuffs. And I asked him, what is this? He said, these are gummies. I said, huh? He said, gummies. I said, what are gummies? Are they chewing gum? He said, no. He said, you chew it consistently until it melts in your mouth, then you swallow. I said, what does he do? He said it helps the skin. It gives you a glass texture skin. And people are using this thing. And products keep coming out day in, day out. And you must understand that these products, they didn't use some trustworthy herbs to do them. These products are a combination of chemicals. And then you take them. You take them even when you're pregnant. So you must let your doctor know that, okay, I'm taking gummies, I'm taking tretinoid, I'm taking retinol. So your doctor has to evaluate, okay, they're taking these things and we're still gonna give you some drugs to take home. But hold on, there is gonna be a drug reaction. No, stop this or stop that. I don't know if you get what I'm saying. So this is just so that we can preserve the life and the physical appearance and the mental dignity and integrity of your unborn child. If you have been using, please stop it. I love you. I'll see you in the next video. But do well to like, subscribe, turn on the notification. I'm here for you.